Yeah, good morning. Thinning hair is something that happens to a lot of people. We think about it, I think, sometimes a little bit more often with men, but it happens to women too. And it's not something that a lot of people feel comfortable talking about, but it does happen, and there are things you can do. So we're going to talk about a few things. The first with Danielle and her mom, Belinda, our registered nurse who's performing the treatment. Danielle, if you could sort of tell us what Belinda is doing as she's doing it. I know we just spun around and separated the platelets.
Correct. So as you can see in this tube right here, there's the blood. It is separated after it's been spun in the centrifuge for 12 minutes.
Okay, so this is her own platelets from her own body that is
Correct.
being used to help stimulate growth.
Yes. So this is injected throughout the hairline. And then also, we go vertically and we'll go down the part too, separating her hair.
And just, we don't want to, I know it's early in the morning, so for those of you who might be sensitive to needles, we'll back up a little bit while the procedure is happening, but you'll be able to kind of see it a little bit from a distance. And one of the things that we were talking about before is that you get these boxes, and each piece, can you show us what's in this kit as Belinda is applying this treatment? Each piece is individually wrapped, so everything is very sanitary, and there is something separate for every single client. And this type of treatment that's happening right now using her platelets, how soon will she see a difference, and how many treatments is she going to need?
So we recommend 3 treatments every 4 to 6 weeks. About after the second treatment, she'll start noticing some little hairs starting to sprout. And after that, you'll just come back in. You want to feed that bulb a little bit so we make sure it's nice and healthy. And after 3 treatments, you can come back in once a year just to kind of feed it, and it'll start growing.
Okay, and how does this work? It stimulates your own cells, right,
Correct.
to do the growth. And I do want to check in with our amazing client, and you can keep on going, Belinda, with what you're doing, but these are needles, and I know that they're not great. Are you doing okay? Okay, all right, I know needles in your scalp probably hurts a bit, I'm imagining, but, and when we were talking before, and she can't really talk right now because she doesn't want to move her head during the treatment, but this is her 3rd treatment, and she was saying that she has started to see some improvement and some additional growth, but it could take a couple months before the full results.
Absolutely.
Okay, so real quick, we have to wrap, but I want real quick, for people who maybe this isn't a treatment that you want to do, there are a couple quick things that you can do if you do notice hair loss. Rattle them off for me real fast.
So no sulfates in your shampoo. Also, you can get biotin injections or IVs. Also
or even
supplements.
Vitamins with biotin, right?
Yes. Yep.
And if you notice you're having hair loss, avoid wearing hats. It'll sort of suffocate the follicles. So there's things you can do if this isn't the right step for you, but if it is, thank you for teaching us a little bit more about how it all works.
Thank you.
Back to you, Simon.